people are living longer. There are not as many schools as we've had before, and we may have to do something about that to provide more schools for nurses. And as you know, a lot of the hospitals that traditionally had nursing programs are no longer in existence. We're going to having licensed practical nursing programs where professional trained nurses on the college level. We're not seeing as many graduate.
No, we didn't know that. I mean, we didn't know those as being problems in terms of trying to prevent us. We thought that it was a problem that had something to do with money. But you've mentioned the fact that we've lost a number of educational institutions that educated nurses. Why don't you expand upon that?
Well, let's talk a little bit about that. For Nashville, for instance, when I grew up and graduated in 1960, we had General Hospital had a nursing program, St. Thomas, and some of the other schools had, Baptist had 3-year nursing programs. I went to a traditionally 3-year program at Grady in Atlanta. Those programs are no longer in existence. And it's because they wanted to provide more quality education in a 4-year program with a bachelor's degree as the interim step. So I think that's why we've had the problems.
And so for the longest, you could possibly be certified as a nurse after going to, well,
you could be an RN after 2 years or 3 years. And back in the 60s and 70s, you had more 3-year programs than you do now.
And now, in order to be an RN, you have to have a bachelor's degree?
No, you don't. You can go to a 2-year program or a 4-year program. So you can have an associate's degree, which prepares you just for the entry level of nursing. It does not prepare you to be a manager. And you do have the 4-year programs that would prepare you to be entry level to management. In the future, I'm sure that a lot of the entry levels may be a master's degree for nurses.
Which would even diminish the number of people that are involved. Now, what if there are some persons who might wish to become involved in nursing this morning? Why don't you give us some information as to what they ought to do to become an LPN or registered nurse or whatever? I think that you know all of the classifications and the designations. Give us that information.
A licensed practical nurse must work under an RN, which is a registered nurse. That is the 9 months to 1 year program. There are some programs here in Nashville. And if a person is interested, the vocational technical school, they may go there or they may go to some of the local hospitals for that. That person is very essential and very important because they must work under an RN. But they're the ones that often give some of the basic care, and we feel that's a very valuable person.
So what about the compensation in these areas?
The licensed practical nurse, entry level with salary, I don't want to get into it that much, but roughly it may be $9 and up an hour.
So these are hourly workers
wages,
for the most part?
Hourly workers, naturally. The registered nurse with a 2-year program or a 4-year program, there are 2-year programs here in Nashville, and here in the Nashville area, there are a lot of schools that are available. The Tennessee Nursing Board can give all the information. If they're interested, they could call the board to find out where the schools are. Then you have the 4-year program that you have with Tennessee State, Vanderbilt, and some of those schools, certainly that a nurse can apply. The entry level, a lot of those schools is just mainly, you know, finishing high school naturally, and some of the students in high school, if they're interested. Many times being a volunteer, we've had some volunteers at our hospital this summer that have wanted to be nurses, and this gives them an opportunity to come and look and see what's going on. And I think that's probably a way to start to get into if you're interested in being a nurse. That's a field that will always be there because we're always going to be sick, and we're growing older, as I mentioned earlier.
And so there are all kinds of opportunities for persons who are willing to serve. I think that there's a commercial that says that if caring was enough to be a nurse, anybody could be a nurse. Now, what are some of the ideas, what are some of the things that you have to have outside of just caring?
Well, I think caring academically, you need to be able to know your math, chemistry, and some of those. You have to be willing to learn and have an open mind, an open heart, and be kind. One of the things that I'm very much concerned about as a nurse is to see people that still are able to touch, are able to look at someone and have some empathy for them. And that's very important. Traditionally, that's the way I've always felt, to be patient, to be understanding, and to also be willing to go just the extra step for a person.
Very good. And in terms of looking at some of the services provided, let's look at what you're doing at Meharry's Hubbard Hospital in terms of the services that are provided.
Okay.
If we talk about nurse care, nursing care at Meharry, what are some of the programs that you have, and what are some of the services that you provide? And perhaps give us as much information as you possibly can dealing with the various programs that you have.
Okay, there are several programs at Meharry. Let's talk a little bit about the inpatient services, because I'm mainly responsible for all of the nurses in the hospital. We have a program in obstetrics where babies are delivered that provide for all the basic prenatal care you can get right at Meharry in the clinic with the physicians, and also anybody can deliver at Meharry if they have a physician who's there. We have some of the best trained nurses there in that area, and if you want candlelight dinner, you can have that after the baby's born. The nurse stays right with you from the time that you begin labor until it ends. We have a nice nursery, excellent nursery, that will provide for any care for anybody in our hospital with a baby. If we do have problems with an infant, we can send them out, but usually we can provide all the care that's needed there. One of the other areas that I'm very fascinated with is what we call our acute geriatrics. As you know, we have a lot of nursing homes here in Nashville. We have a lot of elderly. If a person over 55 becomes ill, they can come to our acute geriatric setting. Our nurses are especially trained to take care of the acute geri person or the patient that comes there. They have additional skills. They have learned it from gerontology. Our doctors are efficient in providing that type of service and the care for that aged person.
Also, and